The concept of universal health coverage, which seeks to provide free services for all citizens, is being pushed ahead as government reiterates plans to go ahead with NHI. MPs are currently weighing up the National Health Insurance Bill. It is the first piece of law that will enable the realisation of the NHI scheme. It proposes a central NHI Fund that will purchase services on behalf of patients, financed in several ways by reallocating medical scheme tax credits, general tax revenue, a new payroll tax and a surcharge on income tax. The bill was tabled in 2019 and right now is up for discussion. And to tell us more, I'm joined by Health Minister Joe Phaahla. Good evening, Minister. Thank you for your time. First question, how much closer do you believe the country is to the passing of this bill and the realisation of the NHI? I know that parliamentarians, the portfolio committee, is going through it clause by clause, and there will still be another round of public participation.
Well, maybe just before I go there, I need to correct you that we're not envisaging specifically additional taxes. I think in our presentation to the portfolio committee, we emphasized that nowhere do we envisage additional personal taxes, surcharges. But what we are saying is that in terms of what is already allocated by the National Treasury to national department, provinces, but also in terms of, you mentioned the medical aid tax credits, of course. Also, we envisage that once the fund is fully operational, there will be all of us who have income will make a contribution, but we believe that even that contribution will be far less than what we are currently, most of us who are working do make contribution to specific private medical schemes.
All right, so if I may, Minister, then don't move on. Hold on a second. I think what we'll do is let's have that question up first, since you've now put it on the table. So we know what it is, and you're saying no new taxation is going to be introduced. You're going to rely on some of the existing mechanisms. So how then, share with us what the detailed plan on funding this is? And also just put a rand and cents value to it if you can, pardon me.
Yeah, what we've been emphasizing is that in terms of expenditure on health as a country, there are recommendations through the WHO, United Nations, in terms of how much countries should spend as a percentage of their GDP on health services. And we are saying that currently when we pull together what is spent in the public health system, which services 85% of the population, and what is spent in the private health sector, which caters for about 15 to 16% of the population. When we pull all those resources on an annual basis together, the figures are there in terms of the public health expenditure through annual reports from Auditor General, National Treasury budgets allocation. On the private side, the Council for Medical Schemes does collate all those costs of private health expenditure. When you put all that together, it gives you on average 8.5% of the national GDP. And we're saying that ordinarily, if we didn't have too much of fragmentation and duplication, that percentage of expenditure would be enough to cover everybody with good quality services. So if those resources can be redistributed, reallocated, we could probably even spend less in terms of what individuals pay additionally, those who have employment and who have income. So that's basically the funding principle which we're looking at.
So I'm at a disadvantage, Minister, because I don't have the GDP numbers right in front of me. But can you round that off then, based on the sums you've done too?
Well, all in all, on an annual basis, we're looking at about just plus minus 500 billion, which is spent when you bring together the private and the public, about 300 billion give and take on the private sector, another 260 billion give and take, or different from year to year, what is allocated to national and provincial health departments. And then, of course, you do have pockets of other expenditures through the Road Accident Fund. You have also departments like correctional services, which spend some money in terms of your correctional services, health services. You may be also on the municipal level, some money spent in terms of municipal health services, environmental services, but also in some municipalities provide some primary health, but also some emergency health services. So plus minus in terms of numbers, we're talking just over 500 billion, which currently is already being spent, and that's what constitute the 8.5 billion we're talking about. And we're saying that if all that currently available resources could be rationalized and cut out duplication and over servicing, especially in the private sector, it should be adequate, and even probably even less in terms of the overpayment which goes on into various services, especially in private healthcare.
So what you're saying is you're satisfied that our economy can support it, and the model that you are envisaging is sustainable.
We believe so. We believe so. We are saying that. Just in terms of if we're to look just in terms of the infrastructure which is available, we know that our public health institutions. You go to Chris Hani Baragwanath, you go to Steve Biko, you go to Charlotte, and go to some of our big hospitals, Grooteskier, all the big centers and even regional hospitals. You'll find that they are quite overburdened, including at the clinics level. But when you go into the cost which they're able to service that 85% of the population, if you go to where more than equivalent amount of that which is spent amongst the private healthcare providers, especially excluding GPs, because GPs have been cut out largely by most of your private funders. They make it very difficult for general practitioners, largely on specialists and private hospitals and radiology, laboratory, and all those. When you look at that, you'll find on average, most of your private hospitals, we've seen also during COVID, there was a bit of a collaboration, but overall on the day-to-day, you will find if you go to most of your private institutions, empty beds, 60% utilization, sometimes even below 50%, when the others next door, which are servicing the rest of the population, are sitting at 85, 90% of utilization. So if you just rationalize just the facilities which are there available, it gives you the sense that indeed more than being short of the facilities is the extent to which what is available is being utilized.
Minister, so much more I wanted to ask you, but we are definitely out of time. Hopefully we can have another interview on this important subject for us as South Africans in relation to healthcare. Health Minister Dr. Joe Phaahla there just briefing us on the latest developments on the NHI.